Hello, this is Marshall Riddle from MCOL, welcoming Dr. Sam Romeo of Tower Health and Wellness Center and Medical Director at the Accreditation Association of Ambulatory Health. Thank you for joining us, Dr. Romeo.
Thank you very much, Marshall. Appreciate the opportunity to be here. Today, I've been asked to talk a little bit about what it is to be patient-centered in a medical home. And I think the biggest challenge we have is the anxiety I have at this point in time about people defining what the medical home really is. On my slide here, I put a picture of just to get a little a personal piece here. I put a picture of my wife and our grandkids. This is our 50th anniversary that we had last May, and all but two of the kids were able to make this celebration for us. But I use this as evidence that we know a little bit about what it is to make a home, and so that's an introduction. But also, in a more concrete piece based on this conversation, is that our group here in Turlock, California, was one of the original medical home studies offered by TransferMed about 5 or 6 years ago. We were one of the small group practices. There's 6 of us in the practice that defined what it was to become a medical home and what the process of transformation really was from the day you decided that you wanted to be a medical home and the day you actually accomplished it. And we also are one of the very early medical home accredited organizations for AAAHC. And we did that obviously because of not only our commitment, but our knowledge and ability to be able to provide this unique kind of a process of how to deliver health care. The next slide I have here is really, it relates to the core subject, which is what patient-centered medical home is. There is so many people talking about PCMH, but very few people are really acknowledging what patient-centered really is. And if you want to know what patient-centered is, I think it's terribly important. You ought to ask the patient. I don't see many people doing that. I think the AAAHC standards insist that you do that, but the other organizations that are looking at or assessing the medical home as a process for the new delivery mechanism is in many cases missing the boat. This next slide is an example of that, where I think the patient-centered, what it really means is having a personal relationship with a provider or a provider team. Also, if you look at the guidelines that were developed actually in the middle 60s and redone in the middle 70s and then restated, if you will, and published more recently by the profession, that in order to have a medical home, you've got to have the assurance that the care is available, it's accessible, it's comprehensive, and it's coordinated. And that the quality means that it's measured based on the perception and the definitions of quality as defined by the patient as well as the profession. But remember, quality ultimately is a patient decision, no matter what. Patients can get good care in lots of places, but their perception of quality is really more than just the application of science or the prescription of the appropriate drug at the right time. So I think the issue, what we're trying to make a point of, is that the hot topics that you hear discussing in most of the conferences about patient-centered medical home right now is how do you create an electronic health record, or how do you report data and case management, how do you do accountability measures, care plans, population health, disease registries, piles and piles and piles of paper. And I can tell you that in my experience, having practiced medicine before all of this stuff began 40 years ago, when the third-party payer entered the examining room and injected the concept of utilization review and quality assurance and PDIS reporting, PQRI, PQRS, authorization, eligibility, underwriting guidelines, all of those initiatives that have come into effect the last 40 years There's no evidence that they've saved us a dime, and lots of evidence that they've cost a lot of money. There's no evidence that they improve care, and that's a growing reality that's being published. And added to that, we've spent millions and millions of dollars, if not billions, attempting to remold the examining room as a result of that. And the problem is we have lost the point of what actually medicine really is, and that is what the patients perceive the needs are and what the provider needs to be able to provide for that. In other words, let's point out that a medical house versus a medical home. There are numerous objective components that make up a medical home or a medical house, such as utilization, quality, authorization, etc., that you can report in different ways. And a general contractor can build these very nice quality institutions, if you will. But they're not homes. And the reason why they're not homes is because that relationship between the patient and the doctor, the patient and the provider, that really is captured in the concept of trust and healthcare, warmth, commitment, and if I dare say, love has got to inhabit those walls to convert a house into a home. And in order to do that, the patients and the providers that's what they're asking to do, and what they're asking for the new change, I believe, in the new guidelines. It's also what patients are crying out for and have for many years. So the relationship is fundamental to the foundation of a medical home under anybody's real definition if it's going to be patient-centered. And I believe, and happen to having done and watched and observed this for the last many years, you just cannot assure that there's a quality relationship without a site visit. It's one thing to say you've got a good medical home. There's one thing to say you've got good EHR and reporting capabilities and those kinds of data objective findings. But it's a whole other thing to be able to be invited into somebody's house and stay a while, observe the dynamics, the quality, the resource utilization, and be able to perceive the smile, the sense of fulfillment, not only in the provider, but especially the patients. And that's what the true medical home is all about. It's the patient and the providers getting together, identifying what the purpose of the whole encounter is, and actually creating an environment where the patient is empowered to assume the responsibility of their own health care. Which those of us who have been around a few years know that patients get well when they want to get well, and they often do not get well when they don't want to get well. They also will get well when they've got the incentive and the ability, knowledge, and support to be able to take the baton, as it were, for their own lifestyle and their own wellness future. So the issue that we're trying to suggest in our AAAHC accreditation process, and what I'm trying to do in my own personal life, is to dedicate what years I've got left to be able to support the concept to revitalize primary care as the appropriate delivery system. It's unfortunate, when I graduated from medical school, 50% of the physicians that graduated went into family medicine. Today it's 7%. And while there's been a slight uptick in the last couple of years, we have a long ways to go to meet the needs of the patients from the patient's perception, and being able to revitalize and reinitiate and have that transformation that we're asking for in the new construct of how to deliver health care in a value proposition, which is a cost and a value and a quality process. The medical home, if we're going to be successful, again, is going to take the patient's perception, put that in the process as the cornerstone, and the relationship with the provider, who then can together identify the lifestyle, the life initiative, the life goals that people want to have within their life, and support their wellness and prevention going forward. If we do that, we're going to get the horse before it gets out of the barn, and actually do more than just case manage disease, but help patients not only stay well but get well once they are ill. And that's the new vital signs, if you will, for the healthcare of the future, which is being defined as the medical home. And that's my short essay, if you will. I'm available by virtue of the slides here that you can call me or contact me in any way. And I promise that for anybody who wants to dialogue with this, I will surely answer this in response to their questions in the future. So thank you very much for the opportunity to express my views, and hopefully you'll find it worthwhile.
Thanks again, Dr. Romeo. This presentation is complete.